Hello and welcome to my channel, or welcome back. My name's Kris. I'm an Australian GP, and one of the most common conditions we manage in general practice is asthma. A lot of people think they know what asthma is, but when we talk about it, realize that they don't know that much. So let's dispel the myths, let's talk about facts and knowledge, and let's deep dive into asthma today. Asthma is a condition in which three things happen. Your airways swell up and become much more narrow. Think about you're trying to drink something initially through a boba straw, so really large diametered straw, and that's pretty easy. But then suddenly, because of asthma, you end up trying to drink the same thing through a little popper straw, so something much more narrow. You have to use a lot of effort. So instead of drinking, think about that as your airways. Instead of being able to breathe through a very thick or very large diametered airway, you're trying to breathe through something very narrow, so real takes a lot more effort and a lot more pressure to do so. The second thing is your airways will develop mucus, which then compounds the narrowing from number one. And number three, your airways will become irritated. This is normally due to some sort of allergen or sensitivity, and it can increase mucus, number two, which can decrease diameter, number one. So they're all very much interlaced. They do not happen in that order, mind you. That's just the order I decided to tell you in. When these things happen, people with asthma tend to cough and wheeze. And the wheeze is the very characteristic thing that people with asthma will have. And mind you, if you have a wheeze, it does not mean you have asthma. The wheeze is because you are trying to breathe through that very narrow thing. So again, instead of you go, again, it's really hard to mimic an asthma wheeze, so I'm so sorry. We don't know the exact cause of asthma, but we do know there are some things that make someone more likely to develop asthma, including having a family history, having a personal history of something like eczema and hay fever, also known as other atopic conditions, and having family members with other atopic conditions as well. So there is definitely a genetic link. Some people will have some very clear triggers for asthma, so they only have attacks when there's smoke around, or cats, or when they exercise or in the cold air. And some people don't have very defined triggers and just have asthma because they have asthma. Some triggers and sensitivities, though, other than the ones I've listed, include pollens, pollution in the air, perfume, dust, other animal hairs and dander, strong emotions, stress, having an acute illness, so being sick can cause asthma, or at least cause a flare of your asthma. Some medications, including beta blockers for your heart, reflux disease, so GORD or gastroesophageal reflux disease, and even some foods, depending on your own sensitivities. When we talk about asthma types, we're really talking about classification. Essentially, how significantly is it impacting you? By knowing how much it's impacting you, we know how we have to treat you. So mild intermittent asthma is you've got a pretty clear idea of what your triggers are, you don't have exacerbations very often, and it doesn't interfere with your day-to-day life. Mild persistent asthma is wherein your symptoms occur more than twice a week, but not daily, and up to 4 nights per month. So more persistent, hence the name. Moderate persistent is asthma in which symptoms occur daily and they start to interfere with your day-to-day activities, but they typically don't occur at night. And then we have severe persistent asthma, in which the symptoms occur several times per day and at night, and they are significantly impacting on your ability to do your day-to-day things. So symptoms of an exacerbation of asthma include, but are not limited to, being short of breath, having a wheeze, finding it difficult to get a good breath in, a tightness in the chest, a dry cough, especially at night or when the air is cooler, distress and irritability, particularly in severe asthma, and fatigue, because it takes a lot of work to breathe. People may also notice their tolerance for exercise decreases. Diagnosing asthma is interesting, especially in times of COVID. So we technically can't diagnose anyone under the age of 5 or 6 with asthma, because at this point, those mechanisms, the swelling, the mucus, and the irritability, may be a sign of what's known as reactive airways disease, which is very common in kids, but may not be because of the same genetic predisposition and whatnot as asthma. So you may have asthma under 6, but it's known as reactive airways disease, and some kids will grow out and some will develop asthma or be diagnosed after age 6. So let's say everyone's over 6 in this scenario. To diagnose, we take a history and we examine. And the thing is, if you don't currently have asthma symptoms, so you're not having an acute flare or exacerbation, you probably examine fine. So what we can do is do what's known as spirometry, in which we test your lung capacity and see if it changes, hopefully increases, when we give you a bronchodilator. Broncho meaning lung, dilator meaning dilation of the air vessels. So it stops number 1, which is that narrowing. If this is the case, you probably have asthma. Mind you, again, you can have normal spirometry and still have asthma. So sometimes we will do provocation tests in which we irritate you, sounds like every test really, but in which we might make you exercise to try and trigger asthma or expose you to something to trigger your asthma and then see if we can reverse those changes. So there's a couple of things. We may also investigate to make sure it's nothing else, including doing things like a chest x-ray. However, this varies, depends on you and your scenario. As for treatment again varies depending on you and your scenario, but may include a reliever, so when you've got symptoms, a puffer to take to relieve them, and or a preventer, so something to prevent you having those symptoms in the first place. What I suggest very strongly is no matter what type of asthma you have, talk to your GP about an asthma action plan. Because right now you might be fine and you might never have had an exacerbation, but one day you might, and you may not remember the things we say in passing, like, oh, if it ever gets worse, do this. You go, what do they say? So this is a piece of paper that says, when you are well, this is what we want you to take. So if you're on a preventer, it may say, take your preventer, which might be, I don't know, Seretide, Flixotide, one of those. 1 puff in the morning, 1 puff at night, done. If you have mild symptoms, take 2 to 4 puffs, for example, of your Ventolin or whatever preventer you have, and that's fine. If you're having more severe symptoms or you are sick, have up to this many puffs, so up to 6 or 12 puffs. In severe asthma where, and it'll list the symptoms, you cannot breathe, you're going blue, your heart rate's above this, etc., have up to 12 puffs every 20 minutes for up to an hour awaiting ambulance. Again, that's a very vague and very cookie cutter action plan I just sort of elicited. This is tailored to you. Sometimes there are other medications. Sometimes it's use this puffer, but if you get to this point, use that one instead, or use this steroid, or there's lots of things. So we tailor it to you. It's really important that I get that point across. Your doctor will also print you signs and symptoms. So you know if your symptoms are mild, moderate, or severe, because what feels severe to you may not be listed. But mind you, that being said, if you feel that your asthma is severe and you need help right then and there, don't worry about what the sheet says. We would rather help you and not have you need that real intervention then than have you call too late or don't call at all. So it's a guide. It's a guide to say what mild is, what moderate is, when to do this. Again, tailored to you. So that was a very quick dive into asthma, what it is, why it happens, and what we do about it. I hope you're enjoying these very quick snippets, sort of, asthma 101, blood pressure 101. If you have any suggestions or videos you do want me to make, let me know. Don't forget to like, subscribe, comment, and all that YouTubey stuff. I hope you are doing well. I'm hoping if you're in Australia, it's starting to cool down because it's the middle of summer now and it is hot. And anyway, until next time, guys, stay safe and stay healthy, and I'll see you in a video very soon.